Hello to all, I am Vishnu. So in this video, I'm going to talk to you about very easy steps in how you can make your hospital duty effective. Now, this is actually a question which I, receive from many people that I am in contact with right now, and they ask me this question that their hospital duties are not going well. Like maybe they are going to the hospital, but they are not getting the proper support from the doctors. Or maybe they are not getting proper support from the department. That means the college where they are studying. Now, obviously, there are a lot of colleges, there are a lot of institutions where things are going in an organized manner. But again, there are a lot of other institutions where, things are not so good. So, for example, you are a student who is attending hospital duties as a part of therapeutics practicals or clinical pharmacy practicals. Or if you are a student who is in clerkship, that is fifth year PharmD, or if you are an intern. And this is also applicable for all those people who are professionals as well, because there are a lot of professionals who, although are working as the designation of a clinical pharmacist, but they are not getting the proper exposure that they actually deserve. So this message is for all of you. Especially this is for students because they are going to be the upcoming professionals in future. Now, here I'm not going to talk about those people who are getting proper support from their department, who are getting proper support from, the hospital. I'm not going to talk about those people because those people are already doing good. They just need to upgrade themselves. I am going to talk about those people who are not getting support at all. So, for example, you are going to the hospital and maybe you are posted in a particular department. Let it be any department. So, you are not able to go on rounds with the doctors. The doctor is not entertaining you, or you don't know what to do there. So, let me tell you what my perspective is. You can approach this in two ways. Number one, the pharmacology perspective, and number two, the therapeutics perspective. Now let's understand what I mean by pharmacology and therapeutics perspective. So when I used to talk to a lot of people, I used to tell them, do one thing. Tomorrow when you go to the hospital, just take a book and write down a list of all the medicines that you have seen in that department. It can be, for example, you're posted in general medicine, you have seen pantoprazole, you have seen paracetamol, you have seen maybe antibiotics, ceftriaxone, meropenem, maybe you have seen multivitamins, whatever it is. Just write down the name of the medicines that you have seen in the department. You don't have to write anything else, no dose, nothing. Just write down if you want to write the dose, it's okay, but just write down the name of the medicines that you have seen. Okay, and once you come back to the place that you stay, your hostel, PG, whatever, home or whatever it is, try to read books which give you amazing knowledge about these medicines. Again, as I said, that your reference needs to be very good, because if you are reading those kind of books, which is rich in knowledge, but you get saturated very easily, then you will lose interest in the subject and you will never have a good career. So if you feel that a particular book is boring you, then you can just go to YouTube. For example, today you saw pantoprazole. You just go to YouTube and type pantoprazole. You will find a lot of amazing lectures. It can be animated lectures. It can be lectures from doctors and pharmacists who write on whiteboard. All those things, you stay in your mind much more better. Or else what you can do is, you can discuss with someone. When I used to tell this to people, I used to tell them, make a list of this and just call me. Maybe at evening or night or something, and turn the recording option on, so that when you tell to me about these medicines, whatever I know about it, if I don't know, that is another thing, I'll refer and tell. But if I know something interesting about that, I can tell it to them. So they'll record it. Later on, they can listen to it and note it down. So this is called the pharmacological perspective. So here we are trying to analyze what are the interesting aspects about a particular medication or a set of medications. Like for example, pantoprazole. Pantoprazole is a proton pump inhibitor. Now, for example, it is a female who is on menopause, and menopause means estrogen is not available. And you know very well that estrogen and calcium are best friends. So after menopause, if the female falls down, there is a risk of osteoporotic fractures because there is no protective effect of estrogen on calcium. Now, proton pump inhibitors, if they are used for long term, they reduce the calcium level much more. So let's imagine a clinical scenario in which a female who is already on menopause and she is suffering from peptic ulcer disease or gastroesophageal reflux disease, all this kind of Zollinger-Ellison syndrome, and she has been given PPI. And if it is going on long term, you can yourself imagine what may happen and what are the things we need to advise to that patient. So this is how we can, correlate things and make our study amazing, rather than simply studying it in the conventional way, mechanism of action, ADR, blah, blah, blah. You can just correlate things like this, and when you study, it becomes more interesting. So if you have a discussion with someone regarding this, I believe it will be amazing. If you want, you can discuss with me also. Only thing is that I get busy at times, but definitely I'll try to come back to you. The second thing that you can focus is the therapeutics perspective. Now, what do you mean by therapeutics perspective? Usually in educational institutions, it is said that you need to have minimum this number of cases a year and all. But I always believe that it is not in the quantity, it is actually in the quality. Like even if you take one case a week, your responsibility is to study that case properly. Like if you are taking 6 cases in a week and you know nothing about those cases, then it doesn't make any sense. So even if you take one case a week, try to follow up that case until the patient gets discharged, if it is possible for you. So you get an entire case in your hands which you can study in detail. Now, what do you mean by therapeutics perspective? Therapeutics means you know very well what is therapeutics. Therapeutics is a combination of 3P and 1D. 1P stands for pathophysiology, 1P stands for pharmacology, 1P stands for patient counseling, and the D stands for diagnosis. So this is the equation for therapeutics. Therapeutics is equal to triple P plus D. So when you are taking an entire case, you are getting this triple P plus D. D means how you diagnose the disease. And obviously when you diagnose the disease has a particular patho. So you will go into the patho also. And then the next P is pharmacology, that is the treatment provided. And when the patient is getting discharged, you come to the next P, that is patient counseling. So when the patient is discharged, what are the things that you can say? Should you take it before food? Should you take it after food? Should you take it with food? And if there are certain side effects of that medicine, what can be the possible symptoms? How you can aware the patient regarding the same. So these are 2 ways as in how you can, make your hospital duty successful. And please make sure you go with the right references. Even if you study therapeutics, please make sure you directly go to YouTube first and then refer books so that you get a good base and then you can remember things better. Don't directly go to the textbook for studying therapeutics. It will make you saturated. Go to YouTube first and then, come back to maybe an authentic textbook which can guide you better. So this is my perspective, and I always don't believe in giving advices because according to me, if I advise someone, it is not necessary that I see from their point of view. But if I talk perspectives, I put myself in their situation and I will tell them what I would have done if I were in their place, if I was in their place. So this is my perspective. I hope this video is informative for you. Please share it with others as well. And if you have any doubts, any clarifications, or you want to discuss any cases with me, please make sure you can WhatsApp me as well. The number will be shared in the description below. So once again, happy listening, happy reading, learn smart, and definitely work smart. Thank you.